Hi everyone, I'm Andrew,
Hi, I'm Angie.
and for today we will be talking about muscular dystrophy. So, first, we will be talking about the learning objective during this slide. So, what we will be tackling on. So, we will be talking about the definition and overview of the condition, the disease process, how it progresses, signs and symptoms of muscular dystrophy, diagnosis, the risk factors involved with it, medical management, and summary and conclusion.
The definition and overview. So, the muscular dystrophy is an umbrella term for a group of inherited diseases that damage and weaken muscle over time. It occurs when the dystrophin gene in the X chromosome has mutated. Muscular means relating to or affecting the muscles. Dystrophy means the degeneration of tissue due to disease or malnutrition. And there are 150 types of muscular dystrophies. We're going to focus on top two. The first one is a Duchenne muscular dystrophy. It's most common and severe form. The Becker muscular dystrophy is a less severe and slower progression.
All right, so before we proceed, we need to find out what the difference between DMD and BMD is. So we made this nifty table for you guys, so it'll be a lot easier for all of us to compare the differences between Duchenne and Becker muscular dystrophy. So first with the dystrophin gene, and we'll be talking about that later on, what it does with our muscles. So with Duchenne, the dystrophin gene is either absent or non-functional, and with Becker, it's present, but it's not functioning normally. For the incidence, 1 out of 3,600 male births do get it. For Becker, it's around 3 to 6 people out of 100,000. For age onset, with Duchenne, it's a lot more rapid. So within 2 to 6 years, you will see that the signs and symptoms will start to show up. For Becker, it starts off later on, so around adolescence to early adulthood. And like what I've said before, with the disease progression, with Duchenne, it's really fast. And with Becker, it's a gradual progression. With non-ambulatory age, so with Duchenne, that's 12 years. And with Becker, that's 27 years. So non-ambulatory, that's when you start to lose the capability to walk. Um, Estimated life expectancy for Duchenne, it's a lot lower. Unfortunately, it's mid-20s with Becker's because of the slower progression. The expectancy is a lot more higher, so it's around 40s. Cardiomyopathy onset, that's when your heart starts to lose its capability to function properly. So with Duchenne, it follows the skeletal progression. So it follows the disease progression. With Becker, it may show up first before the onset of the skeletal progression condition. All right, so for disease process and prognosis. So muscular dystrophy occurs when the dystrophin gene is either missing or has mutated due to a defect on the X chromosome from the parents. The absence of this protein can cause problems with walking, swallowing, and muscle coordination. I'd like to expand a bit on the dystrophin and how important it is with our muscles. So as you can see, we included a picture, but pretty much the function of dystrophin is a protein that maintains the muscle integrity in our muscle cells. So um, it makes sure the muscle cells are bundled closely together, and it also makes sure that it's working properly. If the dystrophin is not present or not working properly, the muscle cells are placed a lot farther from each other, and that what causes instability, and pretty much it also compromises muscle function. So yeah, the prognosis for muscular dystrophy, it really depends on the types, and as what Yunji said, there's 150 of it, and the severity of symptoms. So however, most individuals with muscular dystrophy do lose the ability to walk and may eventually require a wheelchair. Unfortunately, there's no known cure for muscle dystrophy, but certain treatments may help.
So signs and symptoms. The frequent fall is the most significant signs and symptoms, and difficulty rising from a lying or sitting position called Gowler signs, as you see on the pictures. Then trouble running and jumping, waddling gait, walking on the toes, the large calf muscles, muscle pain and stiffness, learning disabilities, and delayed growth.
All right, so for diagnosis, so how do you know if you have muscle dystrophy? First is finding out your medical history and physical examination. So usually, if one of the parents has it, usually it's more of the women's side because both of them have X chromosomes. So usually they have a higher chance of passing it onto their offspring. But yeah, so medical history and physical examination, enzyme tests to measure creatine kinase levels. So a high percentage of creatine kinase in our blood means that there's a huge there's muscle breakdown, significant muscle breakdown going on in our body. Genetic testing, so the X chromosome, muscle biopsy, heart monitoring test. So that happens later on the disease progression with the cardiomyopathy. Lung monitoring test as well, since eventually, and unfortunately, they will start to lose the ability to breathe on their own, and electromyography.
So we're looking for risk factors. So mutation in the dystrophin gene in the X chromosome of the individual. And it occurs in both sexes, ages, and races in general. However, the most common variety, DMD, usually occurs in young boys. And family history of the muscular dystrophy.
Yeah. So medical management. So physical therapy, we will expand on that later on. Respiratory, speech therapy, occupational therapy, drug therapy. So a combination of glucocorticoids, anticonvulsants, immunosuppressants, and antibiotics, and corrective surgery to correct contractures that would happen later on.
So implications for OT, PT, and RAs. OT and OTA can do the prescription for braces, standing frames, and wheelchairs. So assistive devices for ADLs. And energy conservation is one of the important things the OT and OTA can provide because their joints getting weaker. So client education with the uses of devices such as just wheelchair or like power wheelchairs, elective devices, everything.
So for PT and PTA, so RM exercises to maintain the range of motion of their joints. Resistance exercise. The point is we're not strengthening their muscle. But we have to maintain it. So we can't push them too hard. So we're using TheraBands. Hydrotherapy is useful as well because it reduces the strain on their muscle. Breathing exercises. And yeah, so like what I said before, hydrotherapy is really useful for this population.
So summary and conclusion. Muscular dystrophy is a group of progressive disease that causes the muscle to gradually weaken over time. This happens when one of the parents' X chromosome carries a defective or missing dystrophin gene. This lack of dystrophin producing gene causes the muscle to weaken over time, losing the ability of the person to do things that are often taken for granted, like brushing their teeth, feeding themselves, or climbing stairs. Most people will lose the ability to walk or breathe on their own. Unfortunately, there's no known cure for the disease, but with treatments such as physical therapy, respiratory therapy, drug therapy, and corrective surgery, progression of disease could be slowed down.
So here we are. We made a compilation of local resources and contacts. So Muscular Dystrophy Canada, Muscular West Coast Child Care Resource Center, for if you need home care assistance with your kids, self-care, home health products, McDonald's Home Health Center.
The statistics, over 50,000 Canadians have a neuromuscular diseases, of which there are over 150 types. At the bottom of the picture, there's a few of examples. And muscular dystrophy as a whole are estimated to affect 250,000 individuals in the United States. And as a recall, DMD has 1 out of 3,600 male births. BMD is 3 to 6 out of 100,000 male births.
So support group Muscular Dystrophy Canada, they have branches all over Canada, but there's one right here in Vancouver. They're really good. It's a nice support group. They provide equipment, program, and rental. They also do funding. They have family and caregiver retreats and educational resources. And here are our test questions and preferences. So that's it for muscle dystrophy. I hope you guys learned a lot about it. And thank you so much for listening.
Thank you.
See ya.